Hello and welcome to Pippen, your AI-powered physician assistant. My name is AJ, Dr. Kadhim. I'm a family doctor practicing in Toronto, and I'm so excited to show you the Pippen demo. So let's dive right into it. Once you're in the sign-in page, you put in your email and your password, you click sign in, and that takes you to the encounter page. In the encounter page, you can either begin with text or begin with audio. So for the scribing feature, you would just click begin with audio. Once you click that, you see that the microphone is enabled, the recording is in progress, and you see that it has picked up my voice, it's transcribing it fast and accurately. It has also identified my voice as speaker 1. This is very important. So if there's a second person who is in the room, it will identify their voice as speaker 2, and if there's a third person, then it will identify them as speaker 3, and so on. This is very important. It's what we call diarization, and this really helps with the accuracy of the model because it tells you who is saying what, and that is very important for accuracy. Now, let's say you are stepping out of the room. You would click pause recording, and when you're coming back, you can resume the recording. But let's say you have finished the encounter, so you would just click end recording, and here you have the option to edit the transcript or submit it and get the SOAP note. For my purposes, I usually just submit the transcript. I don't feel I have to edit the transcript, and I get impeccable accuracy and results. But for our demo, I'm going to show you how to make changes. This is a previously collected encounter that we collected through Pippen. So you saw how I made changes, and then I can save them and click submit transcript. Now, once I click transcript, you'll see that it starts to give me the SOAP note. You'll see that it's detailed, it's bullet points, and I should say here that we have tested this with masks on. We have tested this with multiple people in the room. We've tested this when we were away from the microphone, for people who have thick accents, as well as in a loud environment like a moving vehicle on the highway. The accuracy was really remarkable. So you get the SOAP note, and then as you see, it's a detailed SOAP note. You would just click this button here, and you get text copied. Right? And then you would post it in the chart. This is a relatively straightforward transcript, straightforward encounter. I've been using this in our own clinic probably 100 times by now, and I can tell you, obviously, the encounters that we see are much more complex. There's lots of issues that patients are bringing up to that single visit, and what I find really powerful in Pippen is that it categorizes it by issue. So I've had sometimes patients bring up 7 issues in one visit, and I was able to actually capture all of that and puts it, issue 1, 2, 3, 4, and so on. So this has been really powerful. Prior to Pippen, it would take me 10 minutes for such an encounter to document appropriately after the patient leaves the room. With Pippen, this is done as soon as the patient is leaving the room, right? So I've showed you the SOAP note. I'm going to show you next 4 additional features. The first one is differential diagnosis. So this is part of our clinical insights. I should first say here that we are not trying to replace the clinical acumen or the clinical judgment of the physician. Those are foundational. But here, if you have a somewhat difficult case and you want to get additional information, with one click, you get a list of common diagnoses, you get a list of do not miss diagnoses, and it's important to compare to what is currently available, right? So if you have a difficult case, you can Google the information and you end up getting sort of non-specific, non-relevant results. You could look things up on a resource like UpToDate, which is great, but it gives you a differential diagnosis of a single symptom as opposed to the whole case. Here you can actually, with one click, get a differential diagnosis of the whole case, which is really, really powerful. Next is the treatment options. So here, with one click, you get a list of treatment options. Again, if you're seeing a simple thing, like you're managing a simple UTI, you're not going to need to use this, right? But as you know, we're seeing more and more complex cases. So instead of simple UTI, we're getting complicated UTIs that are not responding to first line and second line treatment options, or we're getting recurrent UTIs, for example. So here, what I like about this is it actually gives you sort of different things to think about. So first is lifestyle interventions. These are the things that we can counsel our patients on, right? It talks about medications, of course. It talks about procedures and surgical interventions if they're indicated, as well as additional management, like follow-up, for example, and monitoring. So I find this, again, really, really helpful. Next is the referral feature. So here with a simple click and the destination of the referral. So here, let's say we want to send this to sports medicine, right? So I select the specialty and it starts to draft a referral letter for me. What I find the helpful thing here is the reason for referral. Now, you might say I could type this myself, and you're right, that's what we do. But if you're like me, I have a busy practice. I have about 30 referrals at least each week. It takes me about an hour, 2 hours to get that done. Here, with one click, you get a cohesive, detailed reason for referral that you can then copy and paste into your existing sort of integration, whether it's a template in the EMR or the e-referral. So I find that saves me about an hour or two per week. Next is the billing and diagnostic codes. So here with a single click, you get the relevant diagnostic and billing codes. Again, if I'm seeing something common, right? So diabetes, I know the code is 250, right? Hypertension, I know the code is 401. But if I'm seeing something more or less common, I should say, I may, I'm gonna have to either look it up on a piece of paper or a PDF, right, to find that information. Here, with a single click, you get the relevant code. So, for example, this is code 727, which corresponds to ganglion, right? And it also tells you the billing. I'll show you how this becomes really powerful, and I use this as a reference guide. Now, what's really important here that I want to highlight is this chat with Pippen. So with our platform, you can actually interact with Pippen and get more out of the large language model. So I could say, for example, could you rephrase the SOAP note to be more concise and use shorthand, right? You can actually really change it to how you see fit, right? I'll show you many other examples, but this is one way you can make it shorthand, super straightforward and quick note, right? You can interact with it further, like, so you could say, what is the rationale for suggesting ganglion cyst as a diagnosis, right? And then it gives you sort of detailed information about the rationale for it, right? These are just examples. We envision that family doctors can use this how they see fit, and the possibilities are really endless, right? We're just at the beginning of this technology. So here it actually talks about, the rationale for ganglion cyst, based on the details of the case, right? Like, so the location, characteristics, there's no inflammatory signs, right? So I find this is really powerful. Now, when you exit the encounter, so you would just click end encounter, it defaults to date and time. You can change this. So you could say, for example, in this case, let's say it's demo, right? And then you would save it. Now, I showed you the begin with audio. Next, I want to show you the begin with text. So here, when you begin with text, you don't actually need to use a microphone. So you could interact with it and sort of show all these different prompts by just typing, right? So I'm going to show you how I use this for billing, and I use it as a reference. So let's say I want to quickly look up the codes for physical, PAP, and smoking cessation, right? So I just put these there, click on billing and diagnostic codes, and it will give me actually those relevant codes, right? So I'll show you sort of like what it shows. So here is the smoking cessation, for example, and it tells you the fee, It tells you if it's in basket or out of basket. It tells you if it's virtual eligible. I find that's really helpful. And whether you can, it gives you additional information, like you can add this to a K code or an A code, right? So that's smoking cessation. This is the PAP, for example, and these are the K codes based on age. Here's another example. So let's say you saw a patient with fibromyalgia, and I just click fibromyalgia, and I want to just quickly, get that relevant code. So here it identified code 726, which is the fibromyalgia code, and then this is the K code for fibromyalgia, and it tells you that this is out of basket, virtual eligible, and if there's additional information there. So these are sort of some of the ways you can interact with it. I want to show you another one that I enjoy doing. So let's close this encounter and begin another one. So here's an example where I said that I wanted to learn about a medication that I wasn't too familiar with. So I asked it to teach me about Zlox, right? This is without actually using the prompts. So I'm just sort of chatting with the platform, and I wanted to get additional information about this medication. So this is actually a chemotherapy drug. It involves 2 ingredients, and so it tells you what those ingredients are. It talks about how they actually work. For example, you'll see it talks about like the dosing regimen, the side effects, right? So, this would take me some time to get, whereas here you get that information right away, right? So I find this is really powerful. There's many other examples that you could use this. So, here it talks about the ingredients, right? And then the protocol. So this was really helpful, right? Because like to get that information, you really need to dig sometimes. Whereas here, like sort of, it's available to you like within 30 seconds, right? You can actually again interact with it in many different ways. These are the side effects. You can actually use this to, for example, get some guidance on interpreting lab results, right? So you put lab results and you sort of say, like, how do I make sense of this, right? And actually, what I find helpful about this is it gives you rationale. It gives you some ways to think about it and a framework. And of course, then you can use that as a starting point to go and verify. Lots of possibilities of how this is coming to our practices. We have launched in our own clinic, and honestly, it's been a game changer for me. I can't think of going back to the old ways of having to type up everything myself, the inefficiencies that exist, and of course we have a long way to go, but this has been super helpful, and my hope is to reach to my colleagues and sort of guide you along the process and sort of offer a solution that's developed right here in Canada for my peers, for my family doctors across the country. This concludes our demo. Thank you so much for your attention. I look forward to connecting with you. You can reach me directly at team@pippen.ai, and I look forward to having you join us on the platform. Thanks so much. Bye-bye.